On behalf of Michael Holland, this is Chris Catella, and I'd like to welcome you to our final project presentation. So today we're going to be discussing a number of topics. First of all, we're going to talk about our two hometowns. Michael will be discussing Boston. Specifically, the organization that he has chosen is the Centers for Disease Control local office, which is there. And then I will be discussing my hometown of Pittsburgh, and specifically the Allegheny County Health Department. Afterwards, we're going to briefly discuss the distinguishing characteristics of each of our cities. What are the unique aspects to both of them? And then finally, we'll discuss sort of the holistic approach that one can take after reading these two scenarios, the lessons that were learned from there, and how you could apply them to a national campaign. And then afterwards, we'll go ahead and wrap up. But first, I'm going to hand this over to Michael, who will be discussing Boston.
Overview of Boston. Boston. Mayor, Marty Walsh. Population, 687,584. A cultural anchor of a larger metropolitan area known as the Greater Boston. Capital city of the Commonwealth of Massachusetts in the United States. Sixth largest city in the United States. As combined statistical area, also known as CSA, this community region is home to 82 million people. The Boston area has many colleges and universities that make it an international center of higher education. A few of Boston colleges and universities are Boston College, Boston University, Emerson College, and Northeastern University. Centers for Disease Control CDC Boston. The CDC is located in the Boston Central area and is one of the major operating components of the Department of Health and Human Resources. Its mission is to protect America from health, safety, and security threats, both foreign and in the U.S. The CDC fights diseases and encourages communities and citizens to do the same. To accomplish this mission, the CDC conducts critical science and provides health information that protects the nation against expensive and dangerous health threats and respond when they arise. Centers for Disease Control CDC National Influenza Vaccination Week. The CDC established the National Influenza Vaccination Week, which is also known as the NIVW, in 2005 to highlight the importance of continuing flu season. The NIVW is held December 3rd to the 9th to remind people that even though the holiday season has begun, it's not too late to get a flu shot. Center for Disease Control CDC SWOT analysis continued. Threat, legal actions, strain coverage, potential HIPAA violation, mask, employee satisfaction, opportunities, prevent and control diseases, increase communications, publicity, and educate to dispel myths. Center for Disease Control CDC SWOT analysis continued. Threat, legal actions, strain coverage, potential HIPAA violation, mask, employee satisfaction, opportunities, prevent and control diseases, increase communications, publicity, and educate to dispel myths. Centers for Disease Control Boston Research Methodology surveying. People who participated during the National Influenza Vacation Week provide feedback. Focus groups, conducting interviews or groups of people from different venues about the CDC National Influenza Vaccination Week. Research for Disease Control Boston Research Methodology. Outreach campaign events. Pharmacies, Women's Infants and Children, also known as WIC, Massachusetts General Hospital, Community Action Agencies. Centers for Disease Control CDC stakeholders. Greater Boston Center for Healthy Communities is to improve population health by categorizing social change within among individuals, institutions, and communities. Believes that good health is a right, not a privilege. Vision, a world where social conditions and resources foster healthy people in healthy communities. Mission, to help people live healthier lives and create healthy communities through prevention, health promotion, policy, and research. Centers for Disease Control CDC stakeholders, Health Resource in Action provides people with innovative ideas and creates solutions to improve population health, prevent disease and disability, reduce health care costs, and help hospitals, health departments, health centers, and more meeting reporting guidelines around the community health needs. Media, newspapers, Boston Globe, Boston Journal. Radio station, WBZ-FM, WJMN. Television stations, WBZ-TV, WFXT.
Thank you, Michael. Okay, so we're going to talk about Pittsburgh, Allegheny County, and the Allegheny County Health Department. First slide here is just a bit of an overview about the city and the county. The city and the county are the second largest of each of their kind in the Commonwealth of Pennsylvania, behind respectively Philadelphia and Philadelphia County. Both have similar executive and legislative leadership structures. A single solitary figure at the top, whether it be Mayor Bill Peduto or County Executive Rich Fitzgerald, and then they each have a legislative arm, which is either county or city council. Only the numbers vary, but it is a very similar setup there. Major industries include healthcare, which I'll touch upon in a little bit, higher education, finance, information technology, and all of these are changing the demographics of the region quite dramatically as newer, younger individuals move in to replace what has historically been, and I'll touch upon this in a little bit as well, in sort of a population which is skewed older. One other thing of note that I think is worth mentioning here is that Allegheny County has 130 municipalities, and that includes cities, towns, boroughs, and townships. Now, that is impressive. It's the largest in the Commonwealth of Pennsylvania. But when you think about something like a public health campaign that is going to be run in a municipality such as Allegheny County, think about all the coordination that it's going to take to get governmental figures, stakeholders, on board with it, is that you have to deal with 130 different governments, local governments. So, formative research at the beginning and finding out where to put resources and what populations will be more receptive and are of more need than others is going to be absolutely crucial to the success of this program. So as I've mentioned, the organization that I chose was Allegheny County Health Department. Now, it makes sense because it is the right below what you would say would be like the Pennsylvania Department of Health, okay? It's the next in line, and so it encompasses the entire county. It was founded in 1957. Its director is Karen Hacker. It has a multi-pronged set of services. I would argue that most residents in Allegheny County and in Pittsburgh are aware of the Allegheny County Health Department because they license restaurants and other eateries, and then they also grade those places. So if you're caught unsafely selling food, you will be slapped with a fine, and you probably will have your license revoked by the Allegheny County Health Department. And of course, the Allegheny County Health Department is also the formative leader in public health in the region. So anytime a major outbreak of any sorts takes place, they are normally the ones that are contacted, and the media talks to them about this, or that particular situation. So the SWOT analysis, again, wide name recognition. Again, it may be just one part of the prong, but it is a very important part. As I mentioned, they have experience using local media, and they have the support. It may be by default, but they do have the support of governmental figures. Now, the weaknesses, these are things that they sometimes can control, they can't control. They can't control the fact that they are a public entity, in that they will have less money available to them than a for-profit healthcare entity, or even a nonprofit, quote-unquote nonprofit, and I'll get to that in a second. I'm referring to one particular organization. There's just some things that they can't control. There's some things they can control in terms of, because they have such limited resources, they may have a difficulty reaching all parts of the county to be able to effectively, across the board, implement this campaign. Inaccessibility of clinics by the audiences that are intended, or immunization locations. These are things that, you just can't put a person on every single street. It's just not possible. Now, there's opportunities here, and I've alluded to UPMC and Allegheny County or Allegheny Health Network. Those are the two largest healthcare providers that are in the region. UPMC was started by researchers at the University of Pittsburgh, has grown into a nonprofit healthcare provider, which has expanded to Harrisburg, which is this state capital, so about halfway across the state. It is a major force in the region. As well as Allegheny Health Network, which is supported primarily by Highmark Blue Cross Blue Shield. I mentioned Children's Hospital, which is part of UPMC, because opportunities to partner with these well-known community institutions may be, in using the elaboration likelihood model, a means to be able to rope people or entice people to participate in the program. Another aspect that we could use are local celebrities. Pittsburgh is a sports town. I think that is well known by everybody, even if you don't follow sports. So using local well-known individuals, I think that the Allegheny County Health Department can lend credence to their campaign by doing such. Partnerships with local and community charities can also bridge the gap as well. Pittsburgh is a charitable town, and so partnering with like the Pittsburgh Foundation or X, Y, and Z local community, sort of micro level community charities can really make a difference as well. Threats alluded to in the section for weaknesses. Budget cuts may undermine the campaign ultimately. State of Pennsylvania has had crises over and over for the last few years because people just can't agree on having a budget. So that can trickle down and hurt county level initiatives such as this. A substantial influenza outbreak may be too much for the ACHD to handle, and so they may have to call on state and federal resources if it gets bad. And of course, the misunderstanding of any public health issue is prevalent if you don't get the information put in people's hands. And so that puts the onus, of course, on an outreach campaign that is effective. And so how do we go about the research methodology for this? At least formative, if not also during the campaign. And so you take a look at surveys, I think would be an effective tool here because you're looking at, and in the case of where I want to go, and I'm going to skip ahead a couple slides, I would like to use like a campaign goal where yes, we want to immunize everybody, but we also want to target specific audiences that may be more at risk. In the case of Allegheny County and the city of Pittsburgh, focusing on low-income and elderly residents may be a substantially more important goal to have than just the blanket get everybody. And so being able to, at the beginning, have a selection of individuals from across Allegheny County that is across socioeconomic backgrounds to figure out what may work best, I think is a good way to start formative research. It sort of does a couple things. It's a bit of environmental scanning, but you're trying to pull in hard data from the kinds of people and see where they, from all walks of life, what can be the product or what can be the method that is most beneficial to them. Focus groups and interviews. Building upon what I have mentioned about what my targeted publics are. Senior centers, community centers, appropriate venues. Let's get into the neighborhoods, have real conversations with individuals, and find out why they may not do or may not participate in something like this. What are the barriers to entry that may not be able to be pulled from a survey, for example? Secondary data, of course, census data, and then relevant data from the PA Department of Health. We're looking at what communities habitually are the most impacted within Allegheny County and within the city of Pittsburgh, in which we can try to stave further outbreaks through immunization. Now, environmental scanning. Obviously, we're going to be monitoring media mentions and public reaction. Media, Pittsburgh has one major daily newspaper, the Pittsburgh Post-Gazette, has three major television networks, KDKA, which is CBS, WTAE, which is ABC, and WPXI, which is NBC. Public reactions, I think that instituting something like a comment hotline would be beneficial, and especially if we are targeting certain audiences, we want their feedback. Social media feedback maybe might be more for a certain aspect of the outreach group, maybe not for everybody. It's not meant for, maybe it's not as prevalent in senior community as it would be for other communities. And then, of course, outreach events. That's another way of getting the ear on the ground. Again, as I've mentioned before, community centers, senior centers, there are a ton of those in Allegheny County. As I've mentioned before, stakeholders include governmental figures, healthcare figures, and the media as well. The campaign strategies and tactics. A coordinated effort using elaboration, likelihood model informed approach, identifiable figureheads to lend credence and to validate the importance of this particular campaign. Community outreach, getting into the communities which have been identified as being potentially in serious jeopardy in the face of an influenza outbreak. So the low-income communities that exist in the Monongahela Valley, where the steel mills used to be. So Duquesne, McKeesport, Homestead come to mind, Braddock as well. And in Pittsburgh neighborhoods, which skew poor. Homewood, Hill District, West End, those are three that come to mind. There's various other ones that could also be included in there as well. Stakeholder engagement, again, creating partnerships with, and this kind of goes back to elaboration likelihood, but using regional healthcare providers to partner with to increase points of access so that immunization can exist in places where picking up the slack of where the ACHD cannot have their resources go out because they're spread too thin. So how can UPMC, how can the Allegheny County Health, how can Allegheny Health Network help out in this situation? And include figureheads. I think it's a win-win when you have borough leadership, city leadership, county leadership out there trumpeting the importance of this. And so just to have here's just a hypothetical budget of what something like this would look like. All the aspects that one would have to take into consideration, from research to advertisements to staffing, rentals, medical costs, other costs. I'm probably leaving out a lot just because it would be such a comprehensive outreach plan. And then, of course, the timeline.
Okay, so up next, we are going to be discussing the distinguishing characteristics of each of our cities. And first up is Michael with Boston.
Distinguishing characteristics: Boston. Access to healthcare. Boston Public Health Commission Flu Information Center, county's oldest health department. Provide annual reports. Promotes the health and well-being of all Boston residents. Children and adolescent health. Health education training. Peer leadership training. Youth disability awareness.
And so the two characteristics for the city of Pittsburgh, both of which have been alluded to already in the presentation. The first one is the focus of the region on healthcare because of the two major providers being UPMC and Allegheny Health Network. Both are not just located immediately in Allegheny County, but are almost statewide in scope. They are well known, they are respected, and I think that if there were to be an influenza immunization program, that lending their names to that program could increase the validity in many people's eyes, and also would be of net benefit to the Allegheny the Allegheny County Health Department. The additional point I wanted to make, and I've talked about this a little bit earlier as well, is the considerable elderly population, which makes up about 19% of Allegheny County's population. While this is not as strong as it was once due to the influx of younger residents in the region, still it makes up enough of a block of the demographic, or enough of the population block, that it needs to be considered that special communities such as these located in metropolitan areas do have to be taken into consideration when planning for an outreach program such as an immunization program.
So finally, we're going to discuss synergizing. I don't even know if that's a real term, but we're going to roll with it. Synergizing for a holistic national campaign. And I think from what you can call from myself and Michael's research is that having a joint quantitative and qualitative approach is key when trying to expand this to a larger audience. a nationwide audience. I think that using focus groups, personal interviews, surveys, I think we would both agree that it helps target the audiences nationwide that are probably historically, I shouldn't say probably historically, that are historically more susceptible to influenza outbreak. Uh, Using then the data that is culled from sort of the harder side, demographics data, survey data, can help further pinpoint the age groups, the income brackets, the excuses given as to why people don't or have not historically participated in such immunization campaigns. Uh, is there a way that it correlates with socioeconomic statuses? Low income, elderly. Is access to care an issue? Is cost of care an issue? Even though most, if not all, health providers, if you are, and actually that's another great point. If you're covered or not, does that inhibit your access to a vaccine? So I think that is an incredibly important part. Also, I think that it doesn't end at formative, right? It continues as the campaign is rolled out. It is something that you continue to build upon, building data upon as you roll out different aspects of this. Uh, Instituting feedback loops through surveys with program participants and with those who may have heard of the program but are a little fuzzy on the details. Say, if again, using the Pittsburgh example, if you're having a community based outreach program and clinics or mobile clinics are available, are people aware that they're available? Are people aware of the options that are given to them? If there are transportation options, these are really important points. And so, continuing to send receive information, uh, it helps with decision making efforts, which I'm going to get to in a second. Um, but it's also just good practice. The second point is that data driven decision making. You're using data to support arguments for and against potential ideas. I've harped upon this a couple times. I'm going to harp upon it again. The elaboration likelihood model. If A needs to connect to B through an intermediary, a shared interest or a shared entity, um, perhaps that is a way to break through to audiences that may be skeptical. Uh, I know that using an example of the Affordable Care Act, of Obamacare, of the rollout of healthcare.gov, the Obama administration, for example, had used celebrities such as Zach Galifianakis from the Hangover movies, among others, to help sell the idea that you needed to sign up for healthcare coverage if you had not signed up previously, notwithstanding the tax penalty, but just the importance of getting covered. And so, in this case, whatever campaign is used, is there a way that, again, emulating what was used in the Pittsburgh model, of using pop culture or well known individuals to help validate that the campaign is important? And so, another aspect of data driven decision making, beyond who may be the figureheads for this particular campaign, is also is finding out the most effective means of doing this, and that can be through, again, surveys and focus groups. The hard data that you pull from that can inform you whether or not it is worthwhile to have a social media strategy, whether or not it is important to have a TV over radio focus. If you are targeting, and again, I'm going to use my example here, if you are targeting elderly aspect of the population, where do they get their information from? So data that can be culled from the quantitative and qualitative data that is pulled not just in the formative stages, but as you continue on, I think it's helpful because the way that somebody in Sioux Falls, South Dakota gets their information might not be the same as what somebody in New Orleans, Louisiana gets. And so getting data from a widespread, and especially in the case of trying to find what is the most effective media channels for people to find out about this kind of information. Younger audiences are certainly going to want to hear it from social media, but older audiences may want to hear it from the newspapers, from traditional media, TV, etc. And so this, again, either validates or it completely throws off, it casts aside any ideas or pretensions that a certain way can work for everything. It can't. It has to be a staggered campaign is basically what I'm trying to say. All right, and with that, we're going to wrap things up. I'd like to thank you for your time and attention here for our presentation. If you have any follow-up questions, please let us know. We think that this was, we both would agree that this was an incredibly informative experience, made us think critically about the communities that we come from, the capabilities of the institutions that we hold near and dear in times of public health crises. And I think that it was a great way of applying the lessons and the tenets that we have learned over the last 6 weeks to, I think, a very important issue. So thank you very much.